Professor Yehuda Shoenfeld, please, it's your time, up to 40 minutes.
My name is Yehuda Shoenfeld, and I'm coming from the Holy Land, Israel, in which, first of all, we are very close to God. We talk every day with God on a local phone call. And this is also the reason why the people in Israel speak many languages. One of the most popular language is Russian, and therefore I can understand many words in Russian. Alex, Professor Polatayev, asked me to deliver a talk in Russian, but I'm afraid that you will not understand me. Therefore, I have decided to speak and to continue in English, but in Russian accent. So you will understand. The theme of this meeting, which was organized by Professor Polatayev, is about early diagnosis, prevention of diseases in a way that will be very effective. Is it possible? Professor Noel Rose, the father of modern autoimmunity, have alluded to this possibility, and currently we have several options of prevention of early autoimmune diseases. One of them is, by the way, a very simple, effective, and cheap remedy, and this is vitamin D. Vitamin D, 2,000 units per day, seems, at least in experimental models, to prevent almost all autoimmune diseases. By the way, it prevents cancer, it prevents also cardiovascular disease. Why not to take it? And if you will not tell to other people outside of this room, I will tell you a secret. I take vitamin D every day, 2,000 units. Why? Because logically, experimentally, it showed very effective. Second, my father was not so rich, but vitamin D is very cheap. So why not to buy it? And number three, it has no side effects. So this is the ideal preventive measurements if eventually it will be found to be indeed so effective. Another remedy which is popping up is to harness nature or knowledge from nature to our benefit. It is well known that where there are parasites, like helminths, there are no autoimmune diseases. So why not to use this knowledge, either by infecting people with spaghetti of helminths to prevent autoimmune diseases, or maybe the constituents of the helminths, like the eggs of the helminths, like drinking or eating caviar. So this is evolving right now. But for the last 300 years, there was a very, very effective measurement, and these are the vaccinations. There is no question that the best medical event that happened in the last 3 years, despite all the Nobel Prize winnings and so forth, were the vaccine which Jenner developed which prevented deleterious infectious disease which caused plagues and epidemics. And therefore, it is quite often used in national processes or by individuals who take these vaccines. However, as I mentioned before, we have to be aware also of side effects of vaccine. And this is the theme of my talk today. Not to prevent vaccine, not to be against vaccine, but to be aware of these diseases. Before I start, this is the congresses of autoimmunity that we are organizing all over the world, in Hong Kong, in Nice, in France, the big meeting, and also in Latin America. So today I'm going to talk about a new syndrome that we have delineated, which make us more aware of different aspects that were not diagnosed as autoimmune so far. So this is the Asia syndrome, the autoimmune inflammatory syndrome, which were induced by adjuvants. Noel Rose showed why adjuvants are so important when he was able to induce experimental thyroiditis with the adjuvant, but without the adjuvants, he induced autoantibodies but not disease. Most probably, many of the infectious agents cause diseases, including autoimmune diseases, because they are adjuvants. Those who work in laboratory are well aware of Freund adjuvant. What is Freund adjuvant? This is a constituent from Mycobacteria tuberculosis. So this new syndrome is actually a complex of clinical manifestations, by and large, autoimmune manifestations. And as you will see, it is also genetic, which was already stressed by Noel Rose. All autoimmune diseases are genetic, maybe luckily enough. And as you will see, the nervous system is quite often involved, and eventually these symptoms and syndromes can evolve into a full-blown characterized autoimmune disease, one of the 80 classical autoimmune diseases that we have summarized in our book. So we do have criteria, diagnostic criteria, major diagnostic criteria, minor diagnostic criteria, to diagnose the patients who develop this Asia syndrome following being exposed to adjuvants. Now, where do we have adjuvants in the world? And I already mentioned, Noel Rose mentioned, that many of the infectious agents, they have adjuvant, and they induce the autoimmune disease by molecular mimicry, by other mechanisms, but having the adjuvant in their membrane or among their constituents. There is no question that vaccines contain adjuvant. This is basic. We incorporate the infecting agent we can synthetically produce in the adjuvant to increase the immune response that we will be vaccinated. But you will see that adjuvants are more prevalent around us and are responsible for autoimmune diseases. I will touch very briefly silicone implant, breast silicone implants as a source of adjuvant. But even in other conditions like the Gulf War syndrome or macrophage neophysitis syndrome, all of them are caused by adjuvant. Let me start with the silicone implant. The silicone was selected to be implanted in the breast because of its similarity to human consistency, but also because it was believed that silicone is inert to the immune system. And therefore, it was selected because it will be inert, it will not cause any disease. So I want to show you that usually I'm not talking about this subject for the general public, because I don't want to raise panic. I want to be in proportion. I'm talking to professional people. But one day, a journalist sneaked to my lecture in Spain. And as you can see, he published this lecture with a picture, as you can see, of a very famous fashion lady, Pamela Anderson. And as you can see, my picture is here. I want to assure you that this is the closest that I came to the breast of Pamela Anderson. Be it as it may, as you can see, it was not surprising that very soon after the first operations of silicone implants in Japan were done, there was the case reports, 9 cases, 9 females who developed scleroderma after the silicone implants. Why in Japan? Because the Japanese ladies have small teeth and they want to be like in other countries with big teeth. And maybe their husbands want or boyfriends. So already in this first report, it has been noted that there is immune reaction against the silicone, granulomas. And it was believed that it's prolonged, chronic, as Professor Noel Rose said, hypersensitization against the silicone. Very soon afterward, there were 100 symptomatic cases of females who had silicone implants. And you can see that the clinical manifestations were those that we see in autoimmune diseases, despite the fact that it was not a full characterized autoimmune disease, because it's a new syndrome, Asia. As you can see, there was sensory loss, memory loss, you can see myalgia and arthralgia, joint pains and so forth. And in muscle biopsies and nerve biopsies, the reaction was demonstrated. So we have a reaction to silicone. Silicone is an adjuvant, and we have to be aware of this manifestation in women who are implanted with silicone. This is just a very interesting case of rheumatoid arthritis in Brazil that was reported by my friend Roger Levy following a silicone implant into May. Because in contrast to Japan, in Brazil many males like to be transplanted for silicone. So it's world widespread, this phenomena of adjuvant silicone-induced autoimmune disease. How silicone can induce autoimmune disease? This is a paper from 2012 showing in an experimental model that the silicone can stimulate for secretion of IL-17. This cytokine was already mentioned by Noel Rose in his model of the viral myocarditis as an instrumental cytokine which can cause this disease, including the fibrosis that we can see here. In Mexico, women do not have money to implant silicone, so they inject oil, mechanical oil, to their body, and they develop the same changes of scleroderma. So as you can see, people make mistakes all over the world by using adjuvant, and they are not aware that they may develop an autoimmune disease. And we have to be aware for early diagnosis. If we take out the silicone Will the patient recover? Not necessarily. As you have seen in the train of Noel Road, once one of the pieces of the train is fallen, there is no way back. But there are reports in the literature in which explantation of the silicone implant was followed by complete recovery. Actually, I had a patient recently from Switzerland who had scleroderma early stage, and then she told me, you know, I had silicone implant. Should I take it out? And I didn't know what to answer her, because it might be that it will not help, and it's important for her. So I say, you have to decide if to take it out or not to take it out. But what was found, that not every woman with silicone implants will develop autoimmune disease. Only those who are genetically preponderant to develop it, like the HLA-DRB1. Remember this HLA-DRB1. And maybe, Professor Polatayev, that in the future, screening will be done to this HLA-DRB1 to learn to whom to implant the silicone and to whom, as you will see later on, also vaccinate in the future. I want to move from the silicone implants to vaccine, which contains also, as you know, adjuvants. I don't want to frighten you as this dog is frightened when the lady is driving the car. I can assure you that my dog is even more frightened when my wife drives the car. Therefore, I don't go with my wife when she is the driver. I want just again to draw your attention to be aware of this. I'm going to tell you a story of a nice lady called Uti Varala from Finland, Helsinki. Uti Varala was a very close friend of mine many years back, in which we have studied a very interesting autoimmune disease called antiphospholipid syndrome. Interesting disease, the sister of systemic lupus erythematosus, which is associated with pregnancy loss and with thromboembolic phenomena. And she was one of the pioneers of this syndrome in those days. One day, she disappeared from the scene. All my telegrams to her, telephone calls, she didn't answer. And I wondered what happened that she disappeared. And then I forgot about her. Just to meet her after many, many years, 6 months ago, when I had visited this beautiful city in Australia, Brisbane, Australia. And I gave a lecture about the Asia syndrome, and suddenly I see in the middle of the audience Uti Varala. She was dressed with red coat that I will not miss her. So immediately after my talk, I came to her and said, Uti, where have you been? So she told me, you know, I'm living in Finland. Finland is not democratic country like Russia or Israel or United States. In Helsinki, we have dictatorship of the dean. He came to me and said, everything is known about antiphospholipid syndrome. You have to move to diabetes. So I moved to diabetes, and she published very good papers in diabetes. This is Uti Varala. But she said, don't worry, I'm coming back to your mafia. My mafia? What is the mafia? And she told me a very interesting story. 2 years ago, when we had the H1N1 epidemic, a pig influenza, pork influenza, and the whole world was vaccinated, massively vaccinated, with adjuvanted vaccine. Suddenly, when they vaccinated the young people in Finland, there was an avalanche of disease which is called cataplexy, narcolepsy. What is narcolepsy? Look at me. So this is narcolepsy, attacks of sleeping. And this was very strange, but it has been found that 13-fold time actually cases were reported after the vaccine of influenza, the pig or the pork influenza. You don't know, but this disease is strictly associated with HLA, as you can see, DRB10206. So this is already very strange. We have the vaccine, we have the HLA, and it was very strange. This was published in PLOS ONE because they have nominated a committee, and Uti Varala became the president of this committee. And they have found that all the patients who developed narcolepsy had actually the HLA DRB10216, and all of them developed antibodies against the adjuvant, which is called squalene. Here you can see the results, which I will not go into, but you can see that all the patients almost developed the same disease, had the specific genetic background. So what is narcolepsy? In our brain, we have a substance called orexin, and this orexin is actually generated in the hypothalamus. And it was assumed that in narcolepsy, this hormone, this cytokine, is destroyed, like insulin in insulin-dependent diabetes type 1. Now, what is the adjuvant in the vaccine? It's called squalene, which is this structure, as you can see here. And it has been found that all the patients who develop narcolepsy following the vaccine develop autoantibodies against this adjuvant that we say. Moreover, all those who develop these antibodies to the adjuvant had HLA DQB10602, as you can see. So this is very similar to the Gulf War syndrome, where soldiers were shipped to the Gulf area in the olden days, and then developed a disease which was called Gulf syndrome, with very similar symptoms and signs, memory loss, myalgia, and so forth. And it has been found that also patients who were not shifted to the Gulf, but stayed in England or somewhere else, but were vaccinated, developed the disease. And this is very similar also to the macrophage myofasciitis syndrome. This is the paper showing the production of autoantibodies against the adjuvants in this Gulf syndrome. So the question was, narcolepsy, a new disease, which is genetically determined, induced by a vaccine which has adjuvant, it must be autoimmune disease. So the question that we ask, is it similar to the infection that HLA, which Noel Rose mentioned that you need the genetic predisposition together with environmental factor to lead to the autoimmune disease? Or is it because I say that everything is autoimmune until proven otherwise? Or you can say, if you want to find something new, go and see if Japanese didn't publish it before. And indeed, there were already two groups of Japanese people who reported on autoantibodies in patients with narcolepsy against structure in the brain which is called triggers. This reminds type 1 diabetes mellitus, in which we have antibodies against the beta cells in the pancreas, which destroy the beta cell, and therefore we have no insulin and we have diabetes mellitus. So indeed, you see these antibodies against these triggers in patients with narcolepsy. To test this hypothesis, we have applied the Noel-Rose criteria to demonstrate that a disease is an autoimmune in nature. We have written to our Japanese colleague and asked them to send us the serum of the patient with narcolepsy. We isolated these antibodies and injected it to the brain of the mice. But before, this lady from Colombia, working in our laboratory, was able to show that this antibody destroys specifically the cells in the hypothalamus. And this is our mice. You can see that their eyes are covered because of ethical reasons. In Israel, we take care of the mice, that they will not be recognized by their peers. And I am a little bit afraid that next year all the mice will have to sign informed consent before they start the experiment. But as you can see, we have injected these antibodies into the brain of the mice. You see, these are very collaborative mice in our brain. And to our great surprise, we photographed, we filmed the mice. As you can see here, the film is not working right now. But when we filmed the mice, we were able to show that they are playing with themselves, and suddenly they have attack of narcolepsy. After 2-3 minutes, they start to trim themselves again. So as you can see, we have models of narcolepsy in different animals like dogs and even fish. We swimming, suddenly has an attack of narcolepsy, sink down to the bottom of the aquarium. When the attack finishes, it starts to swim again. So as you can see, this is not the only place where the vaccine caused narcolepsy. This is also in other countries in which it happened, and also even in China, as you can see, there was increase in this disease. So, as you can see, vaccine can cause different autoimmune disease. Actually, each one of the 80 autoimmune diseases depending on your genetic background. Therefore, Alex, in the future, we will have to find who are those who are genetically prone to develop autoimmune disease and maybe avoid vaccine or develop new vaccine which are safer, like the vitamin D that I told you before. How vaccine or how the adjuvant is working? The adjuvant is keeping the antigen a long time to be exposed to the immune system. And second, the adjuvant is stimulating the innate immune system with the toll-like receptor, as you can see. So it's not surprising that Wesley Reeves, a very famous rheumatologist, who lives in the United States and made all his career by injecting adjuvant to animal models, and was able to induce all autoantibodies from anti-DNA to anti-SM, from anti-thyroid antibodies and to other autoantibodies. But eventually, also his mice were able to develop lupus, not only autoantibodies, the same story as Noel Rose did with the thyroid antibodies. What is the best adjuvant? The best adjuvant is aluminum. It's cheap and it is used since 1926. It seems that the aluminum, like the silicone implant, is not inert. and it can diffuse from the injection site to the brain, and most probably affect the brain by memory loss, maybe even inducing demyelinating diseases like multiple sclerosis and others. Are we exposed to aluminum in our life? Yes. This is a shop in the airport in the United States. And you see the advertisement. This is just a pen, which is advertised to be constructed just from aluminum. So you can imagine the child, the young child, holding the hand with the pen in his mouth. But there was even a better advertisement in the Time magazine. The advertisement says, men of steel drive cars of aluminum. What is a car of aluminum? It's actually Mercedes. Now we have to study whether rich people who drive Mercedes have more autoimmune diseases than people who take just Japanese cars as others. Do we have evidence, really evidence, that adjuvant can cause autoimmune disease? Do we have experimental models? Yes. These are dogs. You can see also my dog here. This is my clever dog, who, as you can see, he is doing for me the PubMed research. And you can see his satisfaction when he found that dogs who were vaccinated developed different autoantibodies, including anti-laminin antibodies. This is a story of Rottweiler dog. It's not like your dog, which is big. This is a very aggressive dog, and he was vaccinated and developed Guillain-Barré syndrome, paralysis. When he was vaccinated again he developed the Guillain-Barré syndrome. So this is an evidence that re-challenging induced the autoimmune disease. The best story is with salmon fish. Salmon fish, except in Russia, they are not grown anymore in rivers. They are grown in ponds, artificial ponds. And then they tend to get infection. And as you will see, this is from the CNN, called to bring back the salmon that were supposed to be infected. But as you will see, therefore, the farmers are vaccinating each salmon today. And indeed, somebody did analysis of this salmon. He segregated them to different groups, vaccinated, non-vaccinated. And to his great surprise, this salmon, stupid salmon, they read the protocol and develop different autoantibodies, anti-double-stranded DNA, anti-beta-2 GPI, which cause thromboembolic phenomena. These salmon are even more clever than to be published in Journal of Immunology, and they develop granulomas and even, as you can see, thromboembolic phenomena. Moreover, some of the salmon developed glomerulonephritis, like in lupus, and some of them were X-ray in salmon fish, and they found the lesions which are equivalent to rheumatoid arthritis. But not only salmon. My dear friend Andrea Doria, with his students, actually took mice who are prone to develop SLE and injected adjuvant to these mice. And as you can see, they developed higher titers, apropos your questions of anti-DNA, and also shorter survival time. There is a disease which is called alopecia areata. No hair, no in the eyeballs, no in the lashes, no in other places. And it has been shown that this disease follows quite often hepatitis B vaccine. So somebody went to mice who are prone to develop alopecia areata, and they were able to show that they were vaccinated with hepatitis B vaccine, had the alopecia earlier in comparison to the group. So what is the time frame after vaccine that a disease can erupt? Professor Noel Rose already referred to it. Sometimes it will take a long time, not like the usually primary and secondary response. So for instance, we have many papers showing that first you produce autoantibodies, and you should not neglect them. They are not good autoantibodies, and then the disease may erupt. There are 2 studies at least which show that only after 3 years, when you compare patients who were vaccinated to patients who were not vaccinated in a patient in neurology, only after 3 years there was increased incidence of multiple sclerosis. Very similar to it, as you can see, another paper which showed the same result. Only after 3 years, as you can see, there was an increase. Moreover, in the famous journal, respective journal, JAMA, it has been found that the new vaccine, HPV, papillomavirus, was followed 2.5 years after with different autoimmune phenomena. I take the liberty now to say that many of the vaccines are pushed to the public sometime too early, because the vaccine companies have immunity in many countries. So they take advantage of it. And our aim, Alex, is good vaccines, not to avoid vaccine, but vaccines which are not associated with autoimmune disease. So what did we learn today? We have learned that there is a new awareness of a syndrome called Asia syndrome. It can affect our environment. It can affect silicone implant. It can affect vaccines, which are given to billions of people. And we have to be aware of this syndrome, to diagnose this patient, but better to think of safe or more safer vaccine. So as you can see, there are many mechanisms by which the vaccine can cause the disease, autoimmune disease. Some of them are the adjuvants, as I explained. Some of them, as Professor Noel Rose has explained, are the infectious ingredient, like the molecular mimicry, and some of them are due to the preservatives which contain metals like mercury, which we know that mercury can cause autoimmune disease. So you have learned that we can study a lot and take a message from sleeping. I know that many of you slept in my lecture. I noticed that it's not an autoimmune disease. It's environmentally induced. But you can see that there are many animals that can sleep, and therefore we can learn a lot from this combination of new autoimmune disease induced by vaccine. And even Einstein, who said everything is autoimmune until proven otherwise, is happy with me. Thank you very much for your attention.